Hi guys, welcome back to the 11th episode of the Prosperity Project. My name is Braden Turner, and today I am joined by a very special guest, Dr. Kathleen Foote. Thank you for joining us.
Well, thanks, Braden. I'm very excited, and it's a privilege to be here. I've listened to several of the podcasts that you've done before. I've been very impressed. I think it's you and Lily that have been doing the series, and I commend you for taking on such a challenging topic and helping your friends and fellow students sort of address mental health. And I really appreciate how not only do you bring light to the problems that our students and youth are facing, but also try to problem solve and how to make those issues better and giving people solutions. I like that you share the resources. So I'm hoping today that by being here, I can give you some resources from a professional perspective, how we treat depression and things that you can do to help yourself and others.
I think that was the biggest goal of this podcast, was to have the expertise of a pediatrician and what you have to say. But I wanted to ask you to start, what made you want to go into pediatrics?
I could answer, it could be a very long answer. I will be honest in that ultimately, as I love working with kids and their families, pediatrics is a profession that really values prevention. So in medicine, pediatricians diagnose and treat diseases and illnesses. And we are trained to do that, but we also get a lot of training in how to address issues and hopefully prevent problems. So especially when it comes to kids' developmental and behavioral health, and in terms of this podcast are super important things that we learn to address. We really value keeping kids safe and healthy, and so we spend a lot of time working with children and families on doing that. I feel like in pediatrics especially, we're unique in that we have our patient, which is the kid, and we also the families, and pediatricians are almost like coaches for the parents and caregivers of the kids, trying to help them learn how to help children develop safely and giving them tips on how to keep them healthy lifelong. So I really enjoy that about pediatrics.
Awesome. So you've been a pediatrician for a long time now, over 20 years, I believe. How has the overall mental and physical health of children changed in the past 20 or so years that you've worked?
Yeah, I think for the purposes of this podcast, I'm going to focus on the behavioral and mental health issues that we're seeing more of now. And what I like to think about is that, these depression and anxiety was present long before the pandemic. And I think the pandemic sort of accelerated what we were seeing even before. So if you look at data, from the Centers for Disease Control and Prevention, the CDC, even in 2019, they reported that mental health challenges and suicidal thoughts, ideas, and actions among young people was already a severe and growing problem in the United States. And the pandemic certainly worsened that situation. In the year of the pandemic, 37% of teenagers reported they experienced poor mental health during the COVID-19 pandemic, and 44% experienced persistent feelings of sadness or hopelessness during the past year. So even though the pandemic accelerated the mental health issues we were seeing for young people in this country, it was present long before. So it's really something that, especially in recent years, has come more to light. And it's sort of a strength in that now we know we need to look at these issues very closely. We need to have hard conversations, unfortunately, with families and patients about the mental health of our young people. It is a crisis public health situation. If you look at the data, and even before the pandemic, from 2011 to 2020, in Colorado, suicide was the leading cause of death in teenagers age 10 to 18 in Colorado. So that was before the pandemic. So, and it's really sad to me because I feel like this is something we can all work to prevent.
Gotcha. I'm going to pause.
So as a pediatrician, even though I was sort of trained to diagnose medical and physical ailments and treat those, what I found in the last 10, 15 years is that I've been shifting more and more to helping address mental health issues in teens as well. And that was always part of my job, but it seems like it's more prevalent now. It's interesting if you look at causes of death in teenagers, ages 10 to 18 in Colorado. Unfortunately, more children die by suicide in that age group than the leading 8 medical causes of death. So if you consider things like cystic fibrosis, heart disease, lung disease, infections due to sepsis, congenital anomalies, cancer, you add up all the numbers of kids that died between 2011 and 2020, ages 10 to 18, more children died by death by suicide than those other causes combined. So it's a crisis.
Okay. So in regards to that idea and how the pandemic accelerated these suicide rates, as a pediatrician, what are the best strategies that you have learned to combat depression and suicidal ideations among the youth?
So that's a really good question. This is something I work with almost daily at my office. I'm going to start by looking at some of the things we actually don't have control of. There are factors that can make people more prone to depression or anxiety that are things that we can't really prevent.
Okay.
So if you look at like life events, if you lose a parent by death, or you have a close family friend or relative, those are stressors that we can't really, predict or control. Unfortunately, kids that experience trauma, that can lead more to depression and anxiety. Think about kids living in like the Ukraine right now. They're growing up with a war that's around them. So those are things we can't really address. Genetics, obvious people who have family members that also have depression and anxiety, those people are higher risk. So those are things that we can't. What we can do is work on simple things in our daily lives to help stay mentally healthy, kind of emotional hygiene issues, they call them. So simple things like you've talked a lot on your podcast. I forget what you call it's like a wheel of
sources of strength wheel.
Sources of strength, right. So, making sure that you are surrounding yourself with people who are supportive, making sure that you get good sleep. Things like staying physically active helps. There's a lot of data that for mild depression, regular exercise, and we're not talking, run a marathon, just go out and go for a 10-minute walk once a day. Those little things can really help our moods. And I will say the sleep stuff is huge, and I probably didn't realize until my mid-40s how important sleep is. Medical school, residency, not conducive to 8 hours of sleep a night. But, I see kids in the office taking many AP multiple AP classes, sports, extracurriculars, jobs, and you can't do that all on 6 hours of sleep a night. If you don't get sleep, you're going to be more irritable, you're going to be more anxious. It makes you less able to cope when there is sort of a stressor. So I really think that, teenagers, the sleep is important. So
for a teenager like myself or anyone else that may be listening, what do you think is an appropriate amount of sleep consistently per night?
Honestly, we really hope for a minimum at 8.5 hours. Okay. Some need more. I stress, figure out what time you have to be up for school and try to get to bed at least 8 hours before that time, so that you're getting, and then making sure with the sleep you're getting restful sleep, turning off the screens, silencing the phones. Those electronic devices wake our brains up. So it's pretty hard if we're looking at those things right before we go to sleep to then get our brain to calm down.
Is there anything you recommend that teenagers do kind of like 30 minutes to an hour before they go to sleep?
Well, I say turn them off at least, trying to have a routine, you brush your teeth, you read a book, really you should be trying to use your bed just for sleeping. It shouldn't be a place you're doing your homework. because it's one of those things, making sure you have a comfortable place to sleep, lights out, ambient lights, wake our brains up. So sometimes, if you're a person that the minute the sun rises, you wake up, getting those dark curtains, that kind of stuff.
Gotcha. Okay, I wanted to shift topics a little bit. A lot of the audience, including myself, sometimes we may not be familiar or comfortable with handling a situation in which someone close to us is thinking about committing suicide or having suicidal ideations. So how would you recommend someone handle that situation?
So if you're a friend of yours?
Yeah, a friend, family member, anyone close to you.
Well, if you're worried about somebody and they haven't said anything to you, it's a little more challenging. Yeah. But if you're really worried, try talking to that person, just letting them know, hey, I'm here.
Yeah.
If things aren't going well, I'm here to talk. If somebody that's close to you voices that they have thoughts of self-harm or hurting themselves, that's a big red flag to me. And I think that you need to take it seriously.
Yes.
It sounds like, it's from when I listen to other students on your podcast, they talk about, I'm here to listen, I want to help. But I always need them to understand that, you're a friend, you're a young person yourself, and friends are not professionals.
Yeah, exactly.
And so honestly, the best way to be a friend is help that person get professional help. And that can be challenging sometimes.
Okay.
So I find sometimes kids come in saying that, my friend, told me they want to kill themselves. And to me, if you think somebody's at imminent risk, you need to let, that you've talked about the crisis line, the 988, call that. I think you guys also have access to Safe to Tell.
Yep.
So that's another resource. If it's somebody who maybe isn't, in imminent risk, trying to find out if they've talked to their family about it. I know some teens are not comfortable talking with their parents, but you could do things like offer to go with them while they talk to their parents. You had, I believe, Miss Sell is a social worker. Is that right at your school?
Yeah.
Yeah. You can go with them, to talk to her, but trying to get an adult or a professional aware of the situation, because ultimately that's the best way to be a friend.
Okay. Perfect. So then, while a lot of those of us in the community are not professionals, as teenagers, how can anyone with less expertise still make a difference in our community? It doesn't have to be obviously like referring a friend. Like if none of your friends are considering suicide, how can they still make a difference?
Obviously, teenagers are very social creatures. You guys like spending time in groups, and so you've talked a lot in your podcast about joining organizations. If you do have a particular interest in mental health, I believe there's like some peer-to-peer advising type roles you can play. Making, if you see somebody being bullied, it's hard, but saying something right then, even if you don't know that person, if you walk up and help that person through that situation, it might make a huge difference for that individual. Knowing that there's somebody out there that, is watching and looking out for them.
Yeah, perfect. So if someone is suffering from depression and maybe is like scared to take the first step to contact a health care provider but does, what would that situation kind of look like? Yeah,
and I'm really, I wanted to stress that we do take depression and anxiety very seriously for our patients. Even before the pandemic, we were screening all 11-year-olds and up when they come in for their wellness visits or their sports physicals. We ask questions trying to identify depression and maybe somebody that nobody realized that they're having it, even their family. So if we can identify depression early, I feel like we can get therapy and resources going much sooner, and hopefully that will be a better outcome. I'd much rather be proactive. If I know somebody has mild or moderate depression, we can start treatment, and I'd much rather address it in a situation where it's controlled like that than suddenly have like a crisis situation. So if somebody came in and was, had actively contemplating suicide, where I was really concerned for their safety, we have options of getting emergency evaluations done. We have resources with some inpatient units where they can go in and get an emergency evaluation, and if they are safe to go home, they'll be released with a treatment plan in place, and if they're not safe, we will make sure they stay safe until they get proper treatment. I will say that's the rare situation. Most of what I see are kids that maybe are mildly or moderately depressed, and then I'll ask some follow-up questions to assess if they're at risk of suicide. If we find kids that are having thoughts of suicide, then we have treatment that we can start. In addition to therapy and medications, I often work on safety plans with patients. And therapists also do this. I believe in one of your podcasts, you had a young woman that had talked about her experience maybe at an inpatient facility where she did have a safety plan when she left. And I find that is something that we can help people develop. And then that gives them a control, regain control of their safety when they are feeling overwhelmed.
So then what would that safety plan kind of look like? I assume it varies person to person, but...
It's sort of an outline of how it works. There are certain things that are elements of all of them. And one of the elements we ask, and we usually really encourage people to sit down with a professional, whether it's a therapist, a doctor, school social worker, to develop these. And so one of the elements is we ask them to think about reasons for living. So if they're feeling really down, what are some reasons for living? And it can be simple things. I've had patients tell me their pets, kids that have goals, like I've always wanted to climb Pikes Peak, fun trips they have planned, friends that they, want to be around to help. So those are the sort of things we have them outline. Another element we like them to look at is sort of like maybe what are some warning signs or think that their depression might be getting worse. And these, different people, it's going to be different things. Some people spend more time alone or withdraw from activities that they used to enjoy, or crying. But I will mention that a lot of teenagers, when they're depressed, will get irritable or angry. So maybe fighting more with parents, or getting in trouble, acting out at school. And one of the reasons we like to have this really outlined is that this document, once they develop it, they can actually share that with their people they trust, their friends, maybe a school therapist, or a counselor, their healthcare provider, and then people around them. Like if your friend gave you their safety plan and you notice, hey, you used to come to our club meeting every Tuesday and we haven't seen you, you can reach out to them and say, you mentioned that withdrawal might be a sign of your... So, other things we talk about, healthy distractions, things that kids can do when they feel down. They can identify, like maybe they like to listen to music or go for a hike. I think you guys talked about, one of your guests had a sticky notes or something that So having I think about putting a box together with like little pictures of fun times or little notes or gifts, little things that when you're feeling bad, you can open that box and kind of look at it. I really want them to come up with several people that they can turn to for help and support, and being really specific. So like in these safety plans, like first name, last name, cell number, email. So it can be things like a teacher at school who I see every third period. It could be, a friend, a parent. These are non-professional people, but I like them to have a couple of different people in different environments. So that if they can't get a hold of, this friend at, 2 a.m, maybe they have a relative listed who has agreed 24/7. You call me, I'll pick up my phone. So that's another element of the safety plan. We're trying to build multiple things that in a moment of despair or crisis, people pull out their safety plan and they have
Gotcha.
concrete steps.
So you mentioned having people for support, so those giving them your safety plan, so they're equipped to help you. What would that kind of look like? Because you said that again, they're not professionals, so they can only do so much.
Right, but they can also say, "Oh, look, I can tell you're feeling down. How down are you feeling?
Gotcha.
Oh, do you want to just go for a walk? Will that help you feel better?" So that gives them ideas like, "Oh, I know you like fishing. Hey, let's go fishing Saturday."
Gotcha.
Things that you then know what might help them kind of in those. Now, obviously, if it's an emergency situation, this person is not doing well, you call 988, you have the crisis line. As I mentioned, there's lots of resources out there, but we put them in the plan so that in a moment, you can pull it up and look at it. And I think about some other resources that people may not be aware is available. There is a group called the Trevor Project, and that is a group that works with LGBTQ young people, and they have access 24 hours a day, 7 days a week, crisis counselors, 365 days a year. If you get on their website, you can chat, you can talk, you can text, and so that's a resource for those individuals that I think is huge, and it's free, and it doesn't involve necessarily going to an emergency room or to a mental health facility.
Gotcha.
So those things are all part of the safety plans, and another huge part of the safety plan that we work with kids and families is making the environment for the kids safe. So unfortunately, teenagers are impulsive, and we can never predict when or who might attempt to die by suicide. But if we know that you're experiencing suicidal thoughts, making it safe for you in your home, in your environment. So we talk to families about, if there's dangerous medicines at home, making sure that they're locked up. There's no access to that. Unfortunately, we have teens that self-harm and cut. And so for those kids, maybe there's a plan with the family that the razors and the scissors and all of those things are not accessible.
Gotcha.
If a kid needs a razor to shave, they have a code word, they go say to their parent, and then the parent is aware that, here's your razor. Okay, now I'll take it back. Firearms need to be stored, if they're in the home, they need to be stored securely where there's not easy access. If you're living with somebody that's having depression, serious thoughts of suicide, those things need to be in a place where that person can't easily access them.
Perfect. All right, well, that's it from me. If there's anything else you would want to dive into, I think
that was pretty much it. I appreciate all your time and effort, and I was going to give you guys one other resource when you're trying to connect with therapists. I know it can be very challenging finding therapists working with new patients and taking your insurance, but there is a resource through Colorado called imattercolorado.org, and anyone can go on their website. It's available to parents as well as kids 12 and up, and you can fill out a brief survey, ask some questions about your mental health, and then it helps connect you to the appropriate resources. And kids and students, teens can get up to 6 free therapy sessions. It's something, there are some available in person, but most of it will be online. But it's a huge resource maybe for those families that financially can't access therapists, or for those teens who maybe need a therapist but having trouble connecting with one if their families are reluctant to help them connect with a therapist.
Right. So with that, I definitely want to go into some local and national resources that you guys can go to if you need help. NAMI Colorado Springs, or the National Alliance on Mental Illness, they offer several programs regarding improving mental health and plenty of resources to go during a mental health crisis. We also have Safe to Tell, which is an anonymous reporting service where you can report anything that concerns or threatens you, your friends, your family, or your community with a 24/7 service. That's 1-877-542-7233. We also have the Colorado Crisis Services, which offer immediate help to issues regarding substance abuse, sexual identity issues, depression and anxiety, and more. You can also go on the Lewis Palmer School District Counseling page, which is just a great directory source to find extensive resources from local to national scales. Going on to broader resources, we have 988, which is our National Crisis and Suicide Prevention Hotline. You can get online support from a trained professional for absolutely any problem. If you want to get involved, we have the Pikes Peak Suicide Prevention Partnership, which is a community in the Pikes Peak region oriented towards spreading awareness of mental health and suicide prevention through resources, events, and training like QPR, which is Question, Persuade, Refer. And they have a teenager advocacy board if you guys would like to join. And then here in Monument, we also have SO Coalition, or the Social Emotional Wellness Coalition, which is another community in the Tri-Lakes area, partner with PPSP, and also oriented towards teenage mental health and suicide prevention. If you're interested, please reach out to Miss O'Connor, the Lewis Palmer High School principal, or Miss Sell, the Lewis Palmer High School social worker. Thank you guys. Blah, blah, blah.